Emergencies happen every day and anywhere. For the sickest patients, LifeFlight of Maine is wherever you need them.
LifeFlight of Maine is a non-profit air ambulance service that provides critical care transport for folks around the state of Maine and also parts of New England to get critically ill patients from either sort of the scenes of car accidents or other type of traumatic injuries to larger tertiary centers, large hospitals. It also provides a way for transporting patients, again, who are critically ill from small rural hospitals and to larger centers where they can get definitive care.
From the ground, LifeFlight Maine is most easily seen as a fast helicopter that lands on the side of the highway. But inside, there's a high level of critical care going on. The crew on every flight includes a paramedic, nurse, and a pilot, as well as advanced medical equipment.
Well, we have a little bit advanced scope of practice that we operate under. The nurses are able to do certain procedures like put an airway in somebody, do an intervention in the chest and able to let off air that's maybe trapped in there, be able to give blood. The paramedics also have an advanced scope of practice where they're able to monitor people, monitor invasive lines, also give medications that you typically wouldn't find in a regular ground ambulance. We basically bring a pharmacy to the patient when we go out to take care of them. And because of that, we have to do a lot more training is required of us in order to operate in this scope of practice. We have to be able to almost operate at a physician level with these patients. We have ventilators that can actually take people who are very tenuous in their breathing that you cannot find in a ground ambulance, or you can maybe not even find in the local hospital that you have. We carry blood. It's amazing you think 2 units of blood is not a lot, but actually some of these smaller hospitals were doubling their supply of blood by bringing those 2 units with us. The monitoring equipment that we have, we can actually take somebody from the ICU that has invasive lines, and we can keep that, we can monitor that patient just like they are being monitored in the ICU. So there's really no change in how that patient is being taken care of.
LifeFlight 2, stand by for activation.
LifeFlight is hospital-based, but it is a nonprofit entirely responsible for its own funding. Hospitals don't pay for LifeFlight transportation. To cover the cost of caring for uninsured and underinsured patients, as well as capital purchases, LifeFlight depends on donations from those who support their mission. With more than 1,600 calls each year, LifeFlight Maine is especially needed in a state like Maine, which has many rural areas and islands that make receiving emergent critical care challenging.
We like a landing zone of about 100 by 100 feet. We respond to the mountains, respond to the islands. One of the things that's kind of unique to our state of the amount of islands that we have off the coast, and in the summertime especially, we frequently respond to some of these islands. A lot of these islands have volunteer groups that will help run an ambulance, but some of them don't have anything. So we're actually the first responders to some of these islands. And we could be, I can recall one that we went to that we actually had to hike on the trail, and this woman had a broken leg, which you would think, well, why do you need a helicopter for that? It was pretty severely broken, but we had to actually carry her off that trail. We were able to land about 150 feet from where she had her accident and get her to the local hospital. And in that case, we brought her to the closest hospital. But in turn, with that, with a 20-minute flight to the local hospital, she would have been on a boat for about an hour and a half without any pain medication, without the ability to do a good splint and give her medications that she would need.
If we have someone who is coming out of an ICU in a more rural hospital like Northern Maine Medical Center, going to Eastern Maine Medical Center, you want to not only do you want to limit the amount of time that a patient's outside of the hospital, but you also want to be able to provide almost the same level of care that they're getting in the ICU during transport, while they're outside of the hospital. And that's one thing that LifeFlight does really well, is because we have this specialty care set, we are able to mimic that while in the transport environment.
Sometimes we can be described as Maine's 38th hospital. We kind of bring the hospital to the patient. And when you're in this hospital is so rural, it takes a long time to get to some of these hospitals, and that's one of the things that we can really bring to the patients, and their outcomes are a lot better.
For more information on LifeFlight Maine, log on to their website. It's lifeflightmaine.org, or there's a link on myfoxmaine.com.